Greetings, my friends. This is Symona Monet with Healer's Chronicles, and today I am excited to introduce you to the lovely Omisade, and she will be giving a testimonial of the healing that took place as a result of a session that we had in November of 2021, and the awesome results that she received as a result of that session. We will also be talking about the many ways that she can add value to your life because guess what? Omi Sade is also a healer. She is a spiritual healer. She is also intuitive and a herbalist and a RN. Yes, my friends, she works both sides. She's able to heal holistically and through allopathic medicine. She's been an RN for about 30 years and she's also an advocate. She is helping so many people and has helped so many people through their healing journey. Okay, we won't delay. I want to present again Omi Sade.
Good morning, Dr. Symona Monet. Hi. Yes, this is Omisade. I had a healing session with you back in November 22nd, 2021. Um, I have been experiencing chronic right hip pain. During that year or so, I had tried several things to rid of the pain. I went to orthopedic and they did x-rays, MRIs, and at first they thought I had arthritis, and then they just said nothing showed up in either radiology report, so they just said I had what was called inflamed nerves. So I was put on pain meds, which I really didn't think that was a long-term solution. So I was introduced to getting pain injections. I had my first pain injection, I would say it was May of 2019. And what that does, it delivers anesthetic close to a particular nerve to interrupt the nerve signals before they get to the brain. And it did help for about maybe, I would say, I can't remember, maybe 3 to 6 months. And then the pain came back and even more. So I did a second injection, and that only lasted less than a week. So I also tried what's called acoustic shock wave therapy, which is like a probing machine. I call it massage on steroids. That I had 2 sessions. Now these, with this, insurance doesn't pay for. So each session is $150. I was told I probably need 4 to 5. I did 2. I did have less pain from say a 10 to maybe a 5, but I wasn't pain free and it was really bothering me in my daily activities as far as walking, sitting, and things of that nature. Dr. Symona Monet came to me and we did a healing therapy session. She told me that, well, let me back up. I was told sometimes when there's not an actual medical diagnosis for a dis-ease that you're going through or pain that you're going through, is something spiritual. And yes, Dr. Simona Monet picked that up. She told me that my divine cord spirit connection was not fully connected. And that was the issue of the pain. She also, without me even letting her know, because I only said I had hip pain, she said that she saw me having back pain, specifically sciatic pain, buttock pain, leg and foot pain, and that was true. the pain went from my lower back to my right hip straight down to my foot. And I did not tell her that. And she picked that up right away. She said that I had to be grounded and follow my spiritual path. And she told me what those things were. And I knew, but I had fear in me to not go forward with that. As she started doing the therapy on me, I heard the words dismantled. And I could feel the energy on my right side of my hip. It felt like fire. And I could actually, it felt like it was pulling out. And then all of a sudden it was just gone. And I heard her say, pain gone. And at that precise moment when she said that, my pain was gone. But Dr. Symona Monet also felt it also in her. And she also told me things that I needed to do for those next 7 days in order for it to be continue to be pain free. I did the exact steps that she told me to do for the next 7 days, and since then, I would say around December 1st, I've been pain free.
Wow, I am so happy that I was able to help you in such a profound way. But I would like to know a little about what you do. Could you tell the audience what it is that you do, what services that you provide?
Yes, I've been in the medical field for 30 years, a registered nurse for 25 years. My specialty area is trauma nursing and women's health. I also am what's called a nurse advocate. A nurse advocate is one who takes someone that's in a community that is, I would say, basically do not have the basic medical knowledge of what's going on with their body, or maybe perhaps a diagnose that the doctor has told them. For example, I had a young lady just yesterday that a client of mine. She was had a severe. She had surgery, major surgery, and was sent home on blood thinners. She didn't know that she was being sent home on blood thinners until she got home and opened up the bag from the pharmacist. She said that someone had went to the pharmacist and filled her script for her. She opened the bag and there were needles and medicine and needles. And she had no idea what it was, and someone had told her don't take it. She called me and asked me should she take her blood thinners. I said of course. I explained to her what the medication was, what it does to the body, that is to help prevent blood clots due to the surgery that she had, and if she didn't take it, she would risk throwing a clot either in her lungs, her heart, or her brain. And most of the times when a blood clot bursts, you can, you can't feel it when it's traveling. And when it busts, you're gone just like that. Like it's an instant death. In my 25 years of working in the ER, I can say in time I had one case that I can remember that I was able to save only because he was found in enough, he had some type of pain. And he coded on us, and I was able to do CPR right away. But if he was not at that hospital at a certain time, he would have died right instantly. So I told her that, and I told her the nurse before prior to discharge should have went over all her medications that she was going to be home on, and also taught her how to give herself the injections. That's a no-brainer. Like, that's a must. Even as busy as we are in emergency department, if a patient is sent home on heparin injections, our pharmacist in the ER will teach them how to give it, or the nurse will teach them how to give it and send them home with enough supplies until they can go to their primary care doctor. So what I did, we called the unit in which she was on and spoke to the charge nurse. And the charge nurse agreed and said there was no way she should have went home without that. So I was able to advocate and collaborate with her doctor and have a home health nurse sent to her house that day and teach her how to give herself the medications and educate her about the meds that was taken.
I must say, the work that you do is amazing. To advocate for people is this is a job that is so important, is so well needed because we may not know just by going to the doctor what to do or if what they're saying is correct or if we may not just have the understanding about what is being said or the diagnosis. We may feel that the diagnosis is incorrect. We may feel that, you know, whatever treatment is a little bit too invasive. We may have many questions that are very important questions that we cannot just get answered. Because I know for me, I have a family member that's a physician, and she was explaining to me that they only get about 20 minutes for each patient. And that's just not enough time. And so in 20 minutes, the doctor can't, diagnose everything that's going on with you. And so there may be some things that miss. There may be misdiagnosis. They may prescribe you things that you may not understand. And so you must have an advocate. It's something that I think at some part time in our life that we will need in order for us to have the highest level of care possible. So that's why advocacy is so important. And the beauty is with Omisade is that not only is she knowledgeable with and have 30 years of knowledge in the medical field, allopathic medicine as an RN, but she also is knowledgeable about and um, the spiritual and the intuitive. She's intuitive and she's also a spiritual healer and she's also a herbalist. And she also knows what types of foods to put in your body for you to have wellness and the highest level of health, that you can have. And so, Omishade, I would just like to ask you to give your information. If you can give our listeners information on how to contact you, if they want to book an appointment, how would they do that? I would like to just ask you to give that information.
Yes, you can contact me by email at Omisade, my first name, then the letter I and the letter A and the letter M. Omisade is spelled O. M as in Mary, I as in Igloo, S as in Sam, A as in Apple, D as in David, E as in Edward, the letter I as in Igloo, A as in Apple, M as in Mary at gmail.com. And give me your name and what is it that you're concerned about. And I will get back to you right away via email. Also, leave me your number, contact number, and I will either call you right back or send you an email seeing when is the best times to contact you. I also not only in the medical field as far as doing things medical wise, I also do work with herbs also. Sometimes you may not need pharmaceutical meds to help you. Sometimes you can use herbs to help. It just depends on what's going on with you. if I would choose for you to have herbal treatment or actually go see a physician and get pharmaceutical meds. Each case is different, but sometimes you can relieve some things just using herbs, and sometimes you do need that medical pharmaceutical treatment.
So again, you work with holistic and allopathic medicine. Is that true?
Oh yes, most definitely. I've worked with people with high blood pressure. I have one lady. She was taking four different types of high blood pressure medications. I started working with her, giving her um, a herb that specifically treat high blood pressure, and I also changed her eating habits and got her doing some type of exercise. She lost about 35 pounds. Um, Also went to the doctor. Her blood pressure was very low. So the doctor started weaning her off one med at a time. As when we talked again, she's down to two high blood pressure medications. So our goal is to get her off of them completely, but she still will have to do the herbs, still will have to eat right as she's been doing, and still have to exercise. I told her that's very important. It's just like brushing your teeth every morning. Some people may not do it at night, but you're supposed to. But it's just as if waking up, she has to stay in that same routine, or she can have a chance of gaining the weight back and being put back on the medications. So there's some things that I can work with you on. I work with diabetics. I also work with cancer patients. Depending on what stage the cancer is what I do. I have one lady. She was in stage 2 to 3 with her cancer. So I used a combination of herbs for her and had her work with her oncologist. She's doing very well, and last report, she's cancer free now.
I would like to say this is so exciting what Omisade does because it is all about taking responsibility for our own health and being able to maintain that, being able to maintain our health, being able to get up, just like she said, brushing, like brushing your own teeth. We have to think of maintaining our health in the same way. And so the question I have is, how, as far as holistic health and allopathic health, how important it is to have a balance between the two, or is one better than the other? How do you view that?
Again, it just depends on the individual, um, and how soon they come to me. That it just I could use myself for example. I was on high blood pressure meds at the age of 30, 31, which was very young. I was overweight at the time. Um, so what I did have to take two different high blood pressure medications. So what I did for myself, I lost the weight. I changed my eating habits. I started taking herbs to help with blood pressure meds. I never forget one day I was so dizzy. I would stand up and I would almost fall to the ground every time. So I thought my blood sugar was low. Went to the doctor. I didn't have a way to check my blood sugar. Went to the doctor. I was for sure they was gonna tell me I was hypoglycemic, which is low blood sugar. They did my blood pressure. It was 60 over 40. And she was like, "Are you still taking your blood pressure medication?" I said, "Yes." She said, "Stop taking them. You don't have to take them anymore."
Wow.
So the things that I was doing holistically helped me, where I was able to come off my blood pressure meds. So, but again, I have to eat right, I have to exercise, I have to take the herbs. It's not like as if, oh, boom, once you're into that normal range, you can stop everything. That's not true. Whatever
And
you
I
whatever you did to get that way, you have to keep it up.
There it is, my friends. Either allopathic medicine or holistic medicine. We must take responsibility again for our own health and wellness so that we can be the best versions of who what we can be here on this earth while we're here and live the best quality of life, because we can live for years and suffer because we're in poor health. We have dis-ease in our bodies. But one thing I want to ask Omisade again is, could you please give the listeners your contact information again so that they can schedule an appointment? They can start down that journey to health and wellness. You can also contact me at Symona Monet, drsymonamonet.com. And both of our, our information, our contact information will be listed below here, the video. But Omisade, I just ask that you tell the listeners your your contact information so that they can get in contact with you again.
Yes, it is Omisade I am at gmail.com. Omisade, OMISADEIAM at gmail.com. And also, I am also a prophetic reader. So a lot of times when I do my healing or try to decipher the best treatment plan, I go in the spirit and ask for guidance. So I also have the knowledge as far as the degree, but I also have the knowledge spiritually to help people. I not only can do prophetic readings for your health, but for uh, anything that you may have problems with or information. The best way that someone described a prophetic reader or a prophet is that they come to inform and they come to warn. And I find that to be true. We inform people and we warn people.
Let me say, Omi Sade is awesome at what she does. I know I've had a intuitive session with Omi Sade, and not only is she right on target with her insights and everything like that, but she's also very calming. I came out there able to get answers to what it is that I needed answers to. I felt very empowered. I felt refreshed out of the reading and things like that. But she is such a powerful um, woman with many talents: the advocacy, the healing, the prophecy. I call it intuition, but she calls it prophecy. She's a prophet. My friends, I'm telling you, you should patronize Omi Sade, and even if and also my services. I do what is called knee therapy, and knee therapy is an acronym for neural intuitive energy healing, and the N is in representation of neural linguistic programming, which is similar to hypnotherapy, dealing with the subconscious mind. Intuitive, because I use my natural intuitive abilities, is a and it's a big part of the healing process for the for me. And the the E is for energy therapy. I'm trained in many energy modalities, including I'm a Reiki master. I'm also trained in pranic healing, theta healing, Karuna Ki, ascension healing. So I've combined all of that. And then the H, of course, we can't forget about the H. The H is for healing. But I've combined all of this for my own modality, all of the things that I learned throughout the years, and then my natural healing ability, and also my intuition. I've combined all of that to this beautiful, very powerful, and effective therapy. And another thing is, um, with me and Omisade, the session was totally different. She distance. I'm sorry. The therapy, the session was a distant session. We were over the phone, and she's in North Carolina, and I'm in Michigan, and we were able to get those awesome results from a distance because with the type of work that I do, there is no time or space that I can. You can be there. You can be in person. You can be in person, or you can be a distance. I do both, and so most of my clients are distance, and they're getting awesome, powerful, life-changing results. Now, Omi Sade, I would like to ask you now, with your services, can you do those services distance?
Oh yes, of course. Like you say, you're in Michigan and I'm in North Carolina, and you did your healing work on me in my own home in North Carolina and in your home in Michigan. I have worked with, actually, I don't think I've worked with someone yet. Well, yes, I have worked with people here in North Carolina, but I've worked with people out west. I have a client in Vegas. I have a clients in Arizona. I have clients in Georgia. I have clients in Pennsylvania. I actually also working with a client in West Africa. So yes, I can work with you over the phone. I could work with you via Zoom if you want something more interactive, or FaceTime. There's many ways for me to work with you. If you want to do a reading, I can do it over the phone, or I can do it in Zoom. As far as the nurse advocate, uh, one young lady who was in Michigan, how I was able to attend her doctor's appointments. She had me over the phone on speaker and introduced me to her doctor while she was there. Um, and I had one young lady, actually, I had one young lady in Texas that I'm working with. She had me on her phone, the Dua app. So I was able to attend her doctor's office visit with her that way also. So technology has a way where we don't have to travel to meet and greet.
There it is, my friends. Amishade said it, and I also express to you, you can receive our services from the comfort of your own home or wherever you're at. So there's no barrier in taking care of your health and receiving total health for you and possibly your loved ones. So I would encourage you to contact someone like Omi Sade so that she's able to advocate for you, so that you are able to attain total health and be able to, you know, be at peace in your body, not to be in disease. It's you shouldn't have to live this life in disease. You should be living the fullness of life. And so, one question I wanted to ask Omi Sade, I know we talked about and discussed how important it is to take care of any problems that you have, ahead of time. So, how important is it to take care of problems? I know you spoke about a lady who had a cyst under her arm, and you gave that example. Could you let the listeners know about that story? Tell them a little about that story and how important it is for us to be able to manage our health.
Yes. I had gave the example of someone that I knew that had a small cyst up under their arm. Um, it probably was maybe a hard dime size. They did not want to go to the urgent care or the ER. I told them that it had to be cut and drained, which we call incision and drainage. And I said the pus up under there needs to come out, or it's going to build up and get bigger and bigger and bigger. Depending on what it is, it can get into the, it may get into the bloodstream and get infected. You have your blood infected, which is called sepsis, and that's very serious. They said they didn't have insurance. Let them know there's multiple ways that you could get it covered, and I said something small can become something big. If you go now, get it drained. I gave an example. ER bill may be 150. You could pay $5 a month on that. Versus if you let it get bigger and bigger, and it has to be operated on, or something more serious, or you going to have to be in the hospital, that 150 can turn into, say, I'm I'm just giving it, throwing it out there. Say $7,000. So which one would you want to pay? Something small can become something big. So take care of it at the first time that you notice something. Your body speaks to you. My body speaks to me. Listen to your body, and you may can treat it yourself at home, or you may need a physician to help you. I'm here to help you decipher between the two. We can work if it's something minute. Um, Say like a cold. Do you remember back our grandmother days? Well, I'm much older than you, Dr. Symona Monet. So let's say your grandmother days or great grandmother days, they would give you what's called a hot toddy for your cold.
Yes.
Yes. For those who don't know what that is, that's brown liquor, alcohol, with honey and lemon, and you warm it up and you drink it like a tea, and it is very effective in healing colds. It decreases your temperature if you have a fever, and it gets mucus out of your system. It's very, very good. However, I had a time where I was sick. I thought maybe it was something. I didn't think it was the flu, but I just felt congested in my chest. I had chest pain, back pain, um, and high temperature. My father, who's very old school, he came, made me a hot toddy. I did it, sweat it out, but my temperature wouldn't go down. He came back the next day, did it again, and I got worse instead of getting better. So I said, I have to seek medical attention. I went into the ER. They did a chest x-ray. I had pneumonia. So a hot toddy is not going to cure pneumonia. So that's an example of when you should do holistic medicine versus traditional medicine.
Wow, this information has been so beneficial. Omisade has given us so much knowledge. She's given us some jewels today when it comes to our health and wellness, and also offering us the resources for us to be able to maintain and take responsibility for our own health so that we are living this life to the fullest, to the best. And so, unfortunately, it's time for us to wrap up. And, I could talk to Omisade all day. I've learned so much. And hopefully, you have learned a whole lot too. And so, in closing, Omisade, is there some things that you would like to leave for our listeners?
Yes, I just want to thank you so much for having me on your platform, Dr. Symona Monet. I also want to just thank you so much for the healing that you gave me. Um, I literally felt like I was stuck and couldn't move, and I feel free. And it's just so good not to have to be in pain anymore. Even as a healer as me, I couldn't figure it out. So even healers need healers. So
Absolutely.
I thank you, I honor you, I appreciate you.
Absolutely, Omisade, and I do the same. I take a knee to you, just like what my therapy is called, knee therapy, and it's called that again because I take a knee to my purpose, which is to heal and empower the people, and I take a knee to my clients. I take a knee to the divine creator, and am committed to my call, and that is, again, I take a knee not only to Ami Sade, but I also take a knee to you in offering you this podcast, this information. So, namaste, ashe, and so let it be in your lives. Ashe again.